So now Republicans say they have a new idea. They want to let the governors do health care. Not themselves, not Washington, but the governors. Well, the governors met at the White House with U.S. senators and the president a couple of nights ago, and they say, hey, let's do it. Let's take all the taxes from Obamacare, except for the medical equipment tax, and block grant all that to the states. Around $500 billion. Lindsey Graham picked the number. You can give or take a few $100 billion. Let the governors run the healthcare in their own states. They say the partisan divide is less stark among governors than it is among senators. After all, governors have to get things done. They have to balance budgets. They have to build roads. They're accountable for their actions, unlike senators who just have lunch and give speeches and go on talk shows. But on its face, it sounds right in principle. Government at the most local level usually is the most efficient. People are held accountable. That's an interesting concept. But we have a different concept, and that is Medicaid itself and the Medicaid expansion. In 2008, in the country, we spent $200 billion on Medicaid. In 2016, we spent $400 billion. And because of the aging population of baby boomers, that number is going to double every 6 years. Now, some states opted in for the expansion, some states did not, but that growth rate is not sustainable. There's going to be a point where the states will say we don't have enough money. And there isn't just unlimited money. There has to be some sort of cap, or there has to be a slowdown in the rate of increase. But the concept of letting the states do what the federal government can't do, where you have people who have huge deductibles, they can't afford to go to the doctor, or they're opting out of the insurance and would rather pay the penalty, clearly something has to be done. As a third of the counties in the United States have one insurance carrier, more and more have zero. So yes, maybe they could say just let the governors do it. Maybe it's not the worst idea. And that's my 2 cents. My 2 minutes brought to you by Edge Construction and Capital Consultants Bill McCoshen, a lobbyist to work for Tommy, who knows how to get things done. We'll talk about this and more on the Mitch Henck Show on madison.com.